Again, welcome everyone. Thanks for joining our session. I think we have a dynamic session planned for you all. As you're coming in, if you can just put in the chat who you are and where you're coming from and what you're looking to get out of this session. It'll be great to see everyone and introduce ourselves.
All right, everyone. Hello, hello. We're going to go ahead and get started. It is 1:45. Happy Tuesday. So hello and welcome to Prioritizing Mental Health to Better Serve Black Mothers, a call to action. My name is Siani Antoine, and I'm the Maternal Health Learning and Innovation Center representative for today's workshop, and I'll be assisting our wonderful presenters. As a reminder, I want to encourage participants to place any questions that they have in our chat for the presenter, and please remain on mute. Lastly, I want to introduce to you all our lovely host, Ms. Courtney Carter. So Courtney Carter is an experienced breastfeeding support person, former WIC breastfeeding peer counselor, and former centering pregnancy coordinator and facilitator. She also serves on the Maternal Telehealth Access Project's Lived Experience Advisory Group, was a panelist on the Maternal Health Learning and Innovation Center's Skills Institute, and has also been a featured guest on Birth While Black, Giving Birth in COVID-19, a Black Mother's Journey podcast. Courtney Carter has spent the last 11 years promoting breastfeeding and supporting mothers on their breastfeeding journey in her local community. Courtney Carter is also driven by her love for all things pregnancy and mother-baby. She is committed to increasing the initiation and duration rates among breastfeeding mothers of color, as well as also being a voice and source of support for mothers like her who currently deal with or have dealt with prenatal and postpartum depression and anxiety. Courtney Carter is a graduate of the University of North Carolina, also my alma mater, and has graduated with her BA in Communications Mass Media and a psychology minor. Welcome to Courtney Carter, and we'll get started. Thank you.
Thank you everyone for joining us today. I'm just gonna start with Siani also has already given you a brief bio on me, but I am in North Carolina. I am a boy mom of 2, Phoenix, who is 12 years old, Memphis, who is 1. So I pretty much started over 10 years, almost 11 years later, which is interesting and added its own challenges into itself. I am here today because I am a PMAD, perinatal mood and anxiety disorder survivor. And I'm here to share my experience, my lived experience, in hopes that I will be advocating for mothers like me who experience this and feel alone. So I want to be transparent in my presentation today and my answers with what I had dealt with my now 12-year-old and my 1-year-old. I am a Reaching Our Sisters Everywhere community transformer. Due to COVID and loss of my job, I was forced to pivot, and this is where I belong. This is my heart desire, supporting breastfeeding mothers on their journey and being able to advocate for maternal and child health. So I'm going to start with some slides. Give me 1 second. There we go. Can you all see my screen? Okay, all right. So studies suggest that postpartum depression is more likely to occur with mothers of color. And I think most of us have at least heard this statistic once or twice, or maybe more. African-American women were more than twice as likely to experience postpartum and depressive symptoms than white women. The risk is just as high for Hispanic women. And although women of color experience this at higher rates, we are less likely to get treatment for this, which occurred in my situation with my oldest. Studies have shown that Black women were 57% less likely to start treatment for postpartum depression, and Latinas 41% less likely than white women. This is general statistics, but before the pandemic, we're looking at 15% of new mothers or pregnant women saying that reporting that they have dealt with some type of mental health issues. 15% for depression, 29% for anxiety. And again, this is before COVID-19. And after COVID-19, we can see that those rates increased drastically. And I am definitely an example of that. I had a pandemic baby. He was born right as we got to the peak of the pandemic. I came home and the world shut down. So these statistics are showing such drastic changes because of the pandemic. Some of the factors, and I'd like for you to, we'll get through this or into this in my presentation, but I'd just like you to think of some of these factors that play a part in women of color suffering from perinatal mood and anxiety disorders. Lack of access to high quality medical care, lack of social support, gaps in medical insurance, unsafe neighborhoods, increased stress, previous experience with depression or postpartum depression, higher risk of pregnancy and childbirth complications, financial barriers, including lack of paid time off from work, exposure to trauma, and preterm, less than 37 weeks labor and delivery. So I'd like for you guys to just think about that throughout the presentation, and we'll move on, and Criss is gonna help us for the next part.
Wonderful. Thank you, Courtney. I think you all are in for a treat. Courtney is sharing with you all her experience and some of the lessons that she's learned, as well as some of the advice that she might offer to those looking to provide care to Black mothers and birthing people today, tomorrow, and in the future. Courtney, I know that you just shared with us a couple of details in relationship to your experience. And so that folks are aware, we'd like to share a couple of very specific details and just kind of pull them out for your understanding. And Courtney's going to share with you all in great detail, really sort of what her experience in receiving what we might call intuitive care was. And that's, you know, really that screening that you would think should have occur, that referral process, and sort of all of that support that goes into prenatal and then immediate postnatal care. And then we're going to move on to talk a little bit more with Courtney about the experiences that she had having a pandemic baby, and, you know, really sort of what that looked like for her, not just as a mother giving birth during a global pandemic, but as a Black mother giving birth during a global pandemic. And then we're going to move on to talk a little bit more about the importance of practicing cultural awareness and humility, particularly in spaces where mothers are showing up for prenatal care, all the way through to perinatal, postnatal, and on. That support services that can occur both with the provider as well as in the community. And what advice might Courtney have for us in terms of improving that experience for Black mothers and birthing people? So Courtney, did I leave anything out of that?
You did not.
Wonderful. So let's get started. Folks, as you have questions, feel free to put them in the chat. Siani's going to be pulling those out and preparing those for a Q&A period at the end. And also sort of be thinking about the story that Courtney's sharing. What might that look like for you all in your own sphere of influence? What value does this advice give to you? And what ideas might you have about leaving here today in action? We'd love to hear your thoughts and ideas to be able to share with each other. So Courtney, we'll launch in and get started right away. Can you tell us a little bit more about the experience that you just shared with us and that you had related to screening and postpartum for each of your pregnancies?
Sure. So with my now 12-year-old, we're going to He was born in 2009. I had previously suffered from depression and anxiety, and going into that pregnancy, didn't have any screenings. And now in hindsight, just kind of thinking that maybe things were just assumed. I was a flight attendant at the time and trying to navigate what that was going to look like, having a child while also being a flight attendant, the changes that would occur, and of course, being a first-time mom. So with my first pregnancy, I wasn't screened throughout the pregnancy. I was screened at the end. I did let them know that I had anxiety and depression, but I felt like just in my thinking that maybe someone would speak to me about that throughout my pregnancy. After I had him, we were kind of vigilant about making sure that we were aware that of the symptoms of postpartum, but it didn't look like what we thought postpartum depression would look like. I was wanting to sit in the room with the baby and not really going out. There lots of tears, not wanting to hurt him, but just wanting to just be alone with him and wanting to do everything for him. After almost 2 years is when I finally figured something's not right, and I'm still feeling very sad and dealing with some of these same symptoms, and I sought out therapy, and it was very helpful. So, and then in my last pregnancy for that I just had in 2020, that's Memphis, I was screened from the beginning. I let them know that I suffered from depression and anxiety. But it was kind of like once the referral was made, hands were off. The pandemic hit right after I had him, and that kind of changed the trajectory of receiving care. A referral was made after my initial screening. However, that also looked completely different or wasn't the kind of care that I would have preferred. And I'm not sure if I answered everything. I don't want to give too many details before we move into the next question. So Criss, you let me know if there was more that you would like for me to elaborate on.
Yeah, no, this is great, Courtney. I think it's super helpful. I know that your experience is not dissimilar from some of the mothers that you interact with, some of your friends and family and colleagues. And so I think it would be really helpful for everyone if you're able to tell us a little bit more about your experience with screening. I heard you say that there wasn't really a lot of follow-up or referral for that. And then there was, particularly during your first pregnancy, that there wasn't really a lot of screening that you had and were offered during that time either. And so if you could just share a little bit more about that screening experience, and maybe a little bit about how that looks for other mothers, other Black mothers and birthing people that you know.
Right. Okay. So during that screening process, it was just the initial Edinburgh scale that was given to me. I felt like there could be more asking of more questions, like digging deeper. It was very basic. We just did the actual screening survey, and that was that. I do feel like had I not advocated for myself and shared, which most Black women are not sharing what they're feeling, that they're not connecting to their pregnancy or they're feeling sadness. Had I not shared that, I'm not sure that I would have received the referral. I'm not sure that anything the ball wouldn't have started rolling. With my first son, and I'm sorry if I'm jumping, but with my son that was born in 2009, I honestly felt like I wasn't that young of a mom. I was 27, but it just didn't feel heard. Like it just seemed like it was falling on me and my family to make sure that we stayed on top of making sure that I didn't suffer from postpartum. And at that time, I didn't even know that you could possibly be anxious and depressed during your actual pregnancy. So in hindsight, I think I probably did suffer from that, but of course, I didn't think anything of it. And from the initial screening, they didn't catch it. But with the families that I deal with, I actually had spoken to a group of mothers that I interact with daily. And I did a small survey, and over 75% of them reported that they had never gotten treatment. Over 50% of them responded they were never even screened for postpartum depression or perinatal depression and anxiety, which was very difficult because we as Black women are going through so much more. We come in with the anxiety of knowing that the disparities in just when we give birth, that we are more likely to die than our white counterparts. So that in itself creates anxiety that I think these providers and practitioners should be more aware of and cognizant of. But it was very eye-opening to see that over 50, I think it was like 63% of the women that I was speaking to had never been screened. So they weren't sure what they were dealing with. And then on top of that, if they were screened, 75% of them were not receiving treatment. So that's just drastic numbers. It's huge. And when we start digging deeper into the reasons that these screenings are important and ways that we could screen more than just the prenatal and postpartum visit, hopefully we'll get some answers and those numbers will be lowered in time.
Yeah, thank you, Courtney. I think that's really valuable to know, particularly from your perspective. And if I can, I think it'd be great to hear just a little bit more about that moment where you realized with your first son that there was, such a thing as depression and anxiety after having your baby, and you hadn't been aware of that. Can you say a little bit about what that felt like and sort of, what your thoughts were at that point?
Right. So I knew that postpartum depression exists, but I feel like the stories that are shared are always the extreme of women wanting to hurt their children or just being extremely obvious. And my mother, who I'm extremely close to, would say like it wasn't the way that we all thought that postpartum would show up with me. Like I said, I was very vigilant about just wanting to do everything for my baby. Some part of that is that Black super mom, superwoman thing that we are all just told and brought up to know. But I also just sitting there and thinking about I wanted to do everything for him. I also just cried a lot, wanted to be in my room with him, but I never wanted to hurt him or anything like that. But finding out that I could have been experiencing anxiety and depression prior to even having him was very eye-opening, but I didn't know what that looked like. And a lot of people didn't know what that looked like to explain it to me or give me the symptoms that I could have been experiencing.
That's really helpful. Thank you. And so when you think about this experience that you had, both with your first son and your second son, what recommendations would you make or what advice would you give to, so what do you think can be done to improve the experience of Black mothers and birthing people seeking services from providers similar to the one that you received your services from?
I think that screenings should be done and this is a public health issue. I think that it needs to be seen as that, in that we need to start doing screenings more frequently than just in the first visit and then postpartum. I think that it needs to be done every trimester. I mean, we're talking about gestational diabetes, preeclampsia throughout the pregnancy. I think that conversation about perinatal mood and anxiety disorders needs to be talked through and about throughout the entire pregnancy. I think that we should also utilize different providers and practitioners that women are receiving other care from, WIC or support groups, and getting lived experience, talking to mothers about how they're feeling. Sometimes it's not as easy as filling out a survey. There's other things. And I feel like if we spent a little more time in talking to some of these mothers and talking to them throughout their prenatal visits and care, that we would be able to stay on top of this better. But the importance of screening is, like, I just want to say screen, and it can't just be twice. It can't be at the beginning and the end. We have to do this throughout their care.
Yeah, and it sounds like there's a role from your story that providers and other support services, even in the community, could play in relation to warm referrals and warm handoffs to providers, and then just helping folks, if that's not possible, helping folks navigate what that system looks like. And it also feels like following up on those referrals might be valuable as well. And sort of this idea of care coordination and pulling that care coordination, particularly in relationship to mental health. And, you know, when you think about just sort of the postpartum period and just before that period and what mothers might be experiencing. And so I think that's all really valuable for us to be aware of and consider.
Absolutely. It's very important to have that co-coordination in building those relationships, to have, like you said, those warm handoffs and follow up, especially now that we're in this pandemic and it's changing the way people are having their babies and what their experience is like after they have their babies.
Very good point. I think that's fantastic. Thank you for sharing that with us.
Yes.
So I'd like to move our attention maybe to exactly what you were just saying, but you know, the experience that you had giving birth during a global pandemic, right? Carrying your baby to term and what that was like for you. I know many of us are just trying to understand how we can be more supportive in that space for mothers, all mothers, but then particularly Black mothers that might experience the healthcare system in a different way. And not because it's their experience, because oftentimes, as we know, there are some structural challenges that Black mothers come up against in our healthcare systems. So I know that, you know, giving birth during the pandemic, I assume, influenced that experience for you, sort of leading up to the birth of your second child. And I think it'd be great if you would be able to share with us what that, Lord willing, once in a lifetime experience was like for you.
Yes, it's difficult. I have very few people, like, you know, when you have a child, most women rely on their support system, their mothers, their grandmothers, to tell them what things were like and to help them through that process. My mother, in giving birth to 4 children, has never given birth and raised children during a global pandemic. And so this is an experience that not too many, but many women can relate to. It was very difficult, given I had my son right before the pandemic actually reached its peak. So I did get to have like a baby shower and those traditional things. I did have support in the hospital, but it was after the effect and coming home when I thought that I would have access to a lot of support with my family and having my siblings to help me with my son, to now I don't know who can come around. I don't know who's affected. They're saying that it's asymptomatic in some people. So, you know, that having that resource of having that support was very limited. I did have my parents, but like I said, that experience was different. They're wearing masks when they're over here, and being able to take my son out and meet friends, I didn't get to experience that. I really still haven't gotten to experience that. So that was difficult. And then the level of anxiety I began to feel going into this pandemic and hearing all of these stories and not knowing how this will affect me. And my, at the time, 11-year-old is now doing homeschool. It changed everything. And so it exacerbated my anxiety, which I felt like was already a little higher than the depression that I was feeling after having my son. But the level of my anxiety was exacerbated by this pandemic. And how would I receive my medication? What does therapy look like at this point? Because I'm now scared to leave the house, let alone go into therapy and see someone and sit 3 feet, 4 feet from them. So that was very difficult to manage, and trying to figure out how I can still be the best mom that I can be I've lost my job due to this pandemic. At that point, I didn't know, but it was looking that way. And so just trying to navigate around all of that while having a new baby at home, homeschooling a 5th grader, the new baby has colic, you know, it was a lot to really take me down if I hadn't been receiving therapy on medication and just quite honestly praying and a praying mother to get me through all of this.
So I have to say, girl, your strength, it shines through now, but hearing your story, just your strength is, you can tell that you have strength that you're able to draw upon. And thankfully, prayer is beneficial for you and good to draw on as well. And so I'm grateful for that. Thank you for sharing that. Mm-hmm. And I wonder if you could share just a little bit more about the advice that you might give to providers that are seeking to support Black mothers and birthing people during a time of extended crisis like this.
I think we need to make sure that I think we're all aware of it, but it's become so normal. It's been going on a year and a half now that I think sometimes we forget that we are still in the middle of a pandemic, and women who are already in such an emotional state and sensitive time with their bodies and giving birth and wanting that support. I think that we need to be able to acknowledge that and be there for them in every way, and know that this is drastically going to affect their mental capacity, whether that be with anxiety or depression, and that needs to be at the forefront of the care that we are providing. I would also say that we as mothers, as Black women, we have to advocate for ourselves. Unfortunately, the healthcare system has not been helpful to us and has not been very beneficial at times and has not put us as a priority. And so we've got to do that for ourselves as well and advocate for ourselves as much as possible and make sure our support system does the same.
Hear, hear. Thank you.
Mm-hmm.
And so I'd love to move us on to the sort of, when we think about, and I know that there was a process that you went through seeking care after the birth of your second child and receiving care. And that was sort of like almost like a mystical journey that you had to go on, right? And so can you share with us a little bit about what the beginning of that experience was like for you, from the moment that you realized that you needed that care and you sought it out, you know, that referral and, you know, sort of just seeking for a provider during this period?
Okay, sure. So like I said, I knew going into the second pregnancy that I've suffered from depression before with my last son, postpartum depression, and had depression and anxiety in between then. So I noticed some of the symptoms that I noticed and became aware of was that like I wasn't really connecting to the pregnancy, things that I would do like reading to my belly, rubbing my belly, talking to my belly, I wasn't doing with this pregnancy. I was under a high level of stress at the time, but still I wasn't connecting. I was doing a lot of crying, a lot of worrying about, you know, what would happen to my baby, what will happen when I deliver. I'm so close to being at death, and just knowing how, you know, what the outcomes have been for a lot of Black women, that was very scary. And then also some of the social injustices that were going on. And then I'm having a Black son, I'm already raising a Black son, like all of this is going on in my mind. So going on into my prenatal visit, my first prenatal visit, I let them know what I was experiencing. She did the Edinburgh scale survey, and she said that she thought that I should seek some help, some therapy, and my mother suggested the same, but at that point I wasn't quite ready. So she made the referral. Eventually I did decide, you know, this is not getting any better. I know that I don't want my oldest son seeing me go through a pregnancy feeling this way. it's time for me to start seeking therapy. And so I did. Going into it, the main office, the people who were at the front desk, it was very diverse. So I was hoping that I would have a person of color for my as my therapist. I didn't. And then in doing that, or in therapy, there were small things like some microaggressions. She seemed very, very much into or paying attention to like how well spoken I was, how nicely dressed I was. And I found myself having to kind of, which was very, very draining, having to like go back and kind of set the scene for her to where she knows that I'm not this stereotypical Black woman, and kind of direct her focus. I will say that like she was a therapist. She couldn't prescribe medicine if that was something at the time I was interested in. So that required me to see someone else. Virtual visits weren't an option at the time. And it was an hour drive both ways, or 30 minutes both ways. And so there was a lot of things that were kind of like playing part in me feeling like I can't go through with this. This is just creating more anxiety and depression because I'm in this place and I'm admitting that I'm not connecting to my baby and feeling sad all the time. And so there were times that I would go a little longer periods without getting help. And then when the pandemic hit, well, in between then, she left, the psychiatrist left. There was a lot of rollover, turnover at the actual office. And that creates its own challenges and barriers, and created this sense in me that, you know, maybe I just don't need to do this because I can't develop these relationships with people. No one looks like me. I'm trying to like relate on different levels and do all of this backstory to make her aware that I am not a stereotypical Black woman, and that my services and what I'm going through should be a priority. And it just continued on after the pandemic. It got worse with, you know, another psychiatrist leaving. So at that point, it's been months and I've seen like 3 or 4 different therapists or psychiatrists because of the turnover, none of which looked like me. And I felt like the microaggressions or the level of not being able to understand my plight as a Black woman just got worse with each therapist or psychiatrist that I went to. And it got to a point where I just stopped going and sought elsewhere. I did my own research, going on Psychology Today and different groups on Instagram or social media, and just trying to find a Black therapist that I would not have to explain my life or how I come from a good family or I have a, you know, education or something like that. And just to receive care that I knew that would be beneficial for me and to help me get through such a traumatic time that I was going through.
Yeah, so it sounds like a mythical quest to find someone that just understood your culture, where you come from. You didn't feel like you had to explain yourself, and really sort of code switch, if you will, to be able to get the services that you needed.
Right.
That makes sense. Thank you for sharing that. I'll just share with you that a chat popped up that I saw as you were talking, and gratitude for sharing your journey and your story. Folks feel like it's valuable information.
Thank you.
So can you share just a little bit more about, I know that when we were preparing for this session, you shared that you went through 3 therapists before you started on this quest to find a person that you felt understood your culture, where you come from, and you didn't have to, you know, lay this whole foundation out before you could just share what you were going through and feel comfortable doing it. Can you talk a little bit more about what that search was like for you and how it felt when you found the therapist that you ended up with, kind of what that initial experience was?
Yes, absolutely. So the search was draining in itself because the insurance that I had wouldn't cover it, or I would find someone and they didn't take that type of insurance. And then I finally, like after speaking with people and emailing people, I finally found this lady she was heaven sent, because she actually had experience in working with mothers that had perinatal mood and anxiety disorders. And she was willing to do this pro bono. And it was a sigh of relief. She understands me. I'm still seeing her. She understands me. And she met me where I was and has helped me through so much. And just like, I did share my backstory with her, like how I didn't feel like I could open up at first because I had been through 3 people. I open up, they leave, I'm having to, like you said, lay this foundation before I could even open up to what was happening right then. Or my reason why I was there. So seeing her, it was a sigh of relief. She really was heaven sent to find someone who looks like me, can relate to what I go through as not only a Black woman, a Black mother, and just someone that can relate.
Thank you. And so I would just ask you, when you think about all 3 of the topics that we covered today, and most importantly, the idea of providers that practice cultural humility and cultural awareness, what recommendations or advice would you give to folks that are seeking to support Black mothers and birthing people, maybe in a time of crisis, but not just in general, even after we get past COVID? What recommendations would you make?
I would recommend that cultural sensitivity training be high on the list of training to your employees, that you be very intentional about who you're hiring and making sure that they are reflective of the community that they serve, that they have the experience. A lot of times it doesn't seem like this sounds bad to say, but it's true. It's like, maybe I'm the first Black person that some of these therapists have ever interacted with. And at this time, I just think that that's insane to feel that way going into a therapy session. Also, I would suggest making sure that you hear Black women out. A lot of times we don't feel heard. Hearing our lived experience, giving us that safe space to share those things, and coming from a place of truly wanting to know and centering our care around that is going to be extremely beneficial in helping with this.
Thank you. So before we open it up to questions, I know that we have one question and a couple of comments in the chat that will surface in a moment. Siani is going to help us with that. But before we move on, when you think about the 3 topics, and particularly some of the calls to action that you've made here today in relationship to sort of intuitive care, providing that education and awareness and screening before any acute episodes occur, the experience associated with the global pandemic and how folks, providers and community-based folks, can support Black mothers and birthing people in that space, and then practicing cultural awareness and cultural humility. When you think about those 3 things, is there anything additional that you want to share that you haven't had an opportunity to give voice to today that you think is valuable here?
No, but I would like to reiterate the importance of Black women being heard, Black women being compensated for sharing their experience, Black women asked to share their experience, Black women given a seat at the table when we're trying to go over new policies or trying to think about ways to help. Let's ask the Black women who are actually the Black mothers who are going through this and dealing with this, being, I wouldn't even say creative, but for lack of a better word, being more cultural sensitive, but actually thinking about what we go through as Black women and Black mothers, and putting that at the forefront when you're educating, screening, and talking to these mothers throughout their prenatal and postpartum care.
Yeah, thank you, Courtney. And Siani, I think that is a perfect lead into the first question that we have. So maybe we can share the comments after the first question for Courtney, because I think she just laid it up perfectly.
Yeah, that sounds great. So for the first question we have from Mina, do you have any suggestions for how to ask about or explore the role of spirituality / religion in mothers' lives as a source of mental support? And then it's kind of a multiple part question, but is there something we should be doing to speak more, or should we be speaking more about? Does this have a place in the healthcare system? So talking about spirituality and religion.
Okay, great. So thank you for your question. I am not offended if someone says, I don't know where you are spiritually, or I don't know, what your religion is, but do you pray? Like, I think it's just as simple as just asking a question. And to be honest, that's not something that I usually am very upfront about. I don't go into my therapy sessions or my care, talking about where I am spiritually, but I don't mind someone just coming out and asking me. But I think that it doesn't need to be implied that that is the only way to get help, or that's the only way to make it through when you're dealing with a PMAD. In the second part, Siani, did I answer that second part of the question?
Sorry, 1 second. It is.
Yeah, I think you did, except for, sorry, Siani, but does it have a place in the healthcare system? And what I heard you say is that the place that and the role that it might play in the healthcare system is a sensitive one, and that one has to be culturally aware of what both the risks and benefits of asking about prayer and spirituality are, in terms of the value versus the message that you might send. And so asking that question in the right way and ensuring that it comes across in the right way in dialogue, I heard you say is what you would recommend. What else would you add to that, Courtney?
You can just ask an open-ended question, like, what do you do to usually make it through, or to help yourself get through things, or when you're in a high stressed time or going through this global pandemic, what has helped you? What are some of the things that you utilize? And one may not say I pray, or they might say, I pray and go to church every Sunday, or I journal. And I think that that's then your cue to kind of, if that's something that you want to talk about, then you can. If not, then you know where they stand if they hadn't mentioned it.
That's great. Thank you, Courtney. We have another question from Alice. It says, it sounds like you've spent so much time just navigating the system, figuring out who would accept your insurance, scheduling appointments, actually going to appointments, and more. It's a lot. What advice do you have for our systems to make this easier?
I think, thank you, Alice, for that question. More of collective care, having resource lists, offering that information up at our very first visit, throughout the visit, having those conversations and knowing who you have relationships with to have those warm handoffs. So, even if the provider initially cannot give so much time going into something with the mother, being able to just hand her off or give her a resource list and having someone that's going to follow up, because oftentimes you feel like this referral has been made, but no one follows up to make sure that, is this working? Is this therapist I'm seeing, meeting my needs? So I would think that would be the best thing, is to just have that collective care, utilizing different relationships and different resources.
Mm-hmm. Great. We also have a few comments for you as well. Tayshawn mentioned that she serves mothers in New Orleans, and with the effects of the hurricane and COVID, it can be so difficult. She's very thankful for this awesome information to better serve the community. And thank you for sharing your journey as well. Any comments about dealing with, so many different, natural disasters, a hurricane, and then, the pandemic? Any thoughts?
Right. And all of that, I think sometimes we fail to think about also how that affects a mom's decision to maybe breastfeed. Like I said before, like, you know, those things are, it's something that we don't think about, but it's important to know. Like if a mother has decided to breastfeed and then we're going into this global pandemic or hurricane, having resources, having that support, making sure that we follow up or we think about this and be proactive about ways that we can assist during just simply like just the breastfeeding experience or just their mental experience being at home and dealing with this and bringing a new child home. So we have to be proactive in the ways that we think about assisting these mothers.
Wonderful. We also have another comment from Dominique. They mentioned that you are so right. Beyond healthcare providers needing to learn to listen to Black women, it's so important to have culturally appropriate services throughout birth, before conception, during pregnancy, and postpartum care.
Absolutely, absolutely. And I've thought prior to this presentation, just ways that can be possible. So I think recruiting at HBCUs, people who are at these HBCUs doing counseling, getting their degree in counseling, utilizing them to provide services or do follow-ups with mothers. I think some of the other things that we can do is making sure that we're providing, or when we're going throughout our hiring process, asking questions that show if someone has cultural humility or cultural sensitivity. And that may look just simply by asking them to give an example of a time that something happened, you know, that they can show whether or not they've had experience in dealing with the communities that they are serving.
I love that idea about HBCUs. I think that's wonderful. It's great. Dominique also has another question for you. Is there a way to connect with you? I'm also a Black mother of 2 boys. My youngest was born this year, so another baby during a pandemic. She works in Nevada, the Nevada Office of Minority Health and Equity, and is a graduate student. Also, a lot of things are going on, school as well. She would love to interview you and talk to you sometime, but is there a way for people to connect with you?
Absolutely. And I will, I guess I forgot to show that part of my slides. I will put that up on the screen and we can go from there. Thank you, Dominique. I look forward to hearing from you.
Courtney, I can paste your email in the chat if that would be helpful for you.
Oh, okay. You can do that. I was gonna just share this part too. Can you guys see that? Okay.
Yeah.
Those are my 2 boys, Phoenix and Memphis. And so those are the emails that you can reach me, and I look forward to hearing from anyone and everyone. Thank you so much. Were there any more questions, Siani, or comments?
I actually have one for you. Talking about anxiety and depression and also breastfeeding. I'm just curious more about just the willingness to want to continue, because breastfeeding is like a continual practice, like having the energy and the desire to want to do that. If you have any comments about any of that, that'd be great too.
Yes, absolutely. Breastfeeding is just my thing. But I always say that you have truly got to be determined to breastfeed. You really do, because there's so many barriers, so many challenges that will come up that will persuade you to not breastfeed. And so first, and going in with that, you have to be determined, but it was extremely difficult. I breastfed both of my boys, and this second one has been hard, like I said, dealing with the pandemic. So just what that was doing to my mind mentally, and then he was colic and what that did to my mind, but also like just not being able to understand what would make him feel better. And then not even really having access to lactation support, like a lactation consultant. I honestly only saw one while I was in the hospital. It was in the middle of the night. The baby was asleep. So to me, it wasn't very helpful. But you really just have to be determined and seek out support. I'm a part of different groups. I work with Reaching Our Sisters Everywhere. So I had access to those phenomenal women to help me when I was having concerns. But it is totally a different experience. You've really got to be determined to get through it. Because these challenges will come up and try to persuade you to do otherwise.
Okay, thank you for sharing that. If there aren't any more questions, I think it'll be great to transition to your wonderful calls of action.
Yeah.
Right.
So Courtney, I think you gave us some very specific things to think about, and we've got about 10 more minutes left in our conversation today. And I'd be curious to, even just in the chat here, I think someone has already started sharing ways that they might incorporate some of the activities that you've mentioned and some of the advice that you've shared in terms of what would have improved your experience. And I wanted to give you, while people are thinking about that and sharing that in the chat, I wanted to give you the opportunity to just kind of restate your calls to action for each of these areas. And so when you think about providing that intuitive care, the awareness, the education, and the screening and referral before any major acute episodes occur, what sort of, in summation, what would you recommend to folks? What is your call to action?
Just to provide intuitive care, to put Black women, to put mothers as a priority, but specifically Black women, because there's so many statistics. We know the racial disparities. So going in knowing that, we know that we should be a priority in our healthcare. The other should be just acknowledging the effects of a global pandemic, because I'm still finding out or realizing ways that this pandemic has affected me with my anxiety and my depression. And so just going in with acknowledging the effects that this has on us. And then on top of that, the layers of coming home with a new baby, going through a pregnancy during that, how the traditional laboring and delivery has changed, or prenatal care has changed. So that needs to be a focus. And when you're giving your care, you need to acknowledge that. And also just commit to diversifying the professions of psychology, psychiatry, offering care with people who look like the community that they service. That's so important. I can't express enough the importance of being able to relate to the person that I'm seeking therapy from. So those three things are what I would say my call to actions were.
Wonderful, thank you. And then it also feels like offering ongoing support in this space, education, awareness, and even just information about what postpartum looks like, right? Like what postpartum mood disorders might look like, because the messaging, it sounds like you received, was very extreme cases. And so you didn't really relate to that. And it took you a while. And it sounds like messaging about this in multiple ways, offering multiple examples, and normalizing that experience and that process, it sounds like that would have been helpful to you as well.
Yes, absolutely. Education on what it looks like, and realizing that it doesn't look the same in everyone. So having this cookie cutter image of what we think a mother who is suffering from postpartum depression or anxiety even looks like. And like I said, I didn't know that you could experience this prenatally. And so even normalizing that, and this is why I'm here, because I want to put a face to that. And I want to normalize it as much as possible when I talk to my other counterparts or colleagues, and I just see how so many of us are suffering and no one's talking about this, and we feel alone in this. I want to be able to advocate for that, and to also show that I have went through it and normalize it as much as possible.
Yeah, wonderful, thank you. Was there anything else that you wanted to share with this group before we wrap up today?
No, I think that we got it all out, and I want to thank you all so much. And Criss, thank you for interviewing that out of me. I really appreciate that. Thank you everyone for coming and for the comments and the questions. If you can just advocate for Black women, for equitable care for Black mothers, and just prioritize our mental health, because it's Our Black babies are dying at high rates. We are dying during delivery at high rates. And that alone should be a reason why this should be a priority to you all.
Wonderful, thank you. And so before we wrap up, I wanted to offer folks an opportunity. You can unmute yourself if you have questions or ideas about how you might make changes or leave here in action, or how valuable this information has been for you in your own sphere of influence. So I'm gonna give folks a moment if they wanted to unmute. Okay, hearing none. Courtney, I just want to say to you, having worked with you over the past week or so in preparation for this conversation, and then listening to your story and seeing your strengths and just your spirit in this space, I'm grateful for the experience, and I'm so grateful that you're willing to share this information and that you're willing to advocate in this way, because I think this information is so valuable, and sometimes we don't often get it in the way that you've been willing to share it with us and with the candor that you've been willing to share it. So please keep sharing your story and draw strength from this experience. Thank you.
Thank you. Thank you so much. Thank you, everyone.
I just want to share some closing remarks as we get ready to head to the next sessions. Again, thank you so much, Courtney, for sharing your experience today. It was very valuable. I know I've learned a lot. I'm sure the audience has as well. And I want to just say, please continue as for the audience to look forward to the next symposium workshops, which will start at 3 p.m. And I hope that you all have a great rest of your week. Thank you so much for participating.
Thank you.